Hello, ladies. We welcome you once again to GOC Grace channel. We will explore more about cervical cancer in this post. Don't try to take care of your health on your own. Consult with a doctor for advice. Kindly repost this to get to more women who may need this information. Drop a comment if you want to be linked to a doctor. Cervical cancer is a malignant tumor that forms in the cells of the cervix, that is, the lower, narrow end of the uterus that connects to the vagina. It is one of the most preventable and treatable cancers if detected early. Yet it remains a significant cause of death among women, especially in low and middle-income countries due to lack of screening and treatment services. Anatomy of the cervix. The cervix has two main parts. Endocervix, the inner part, closest to the uterus, ectocervix, exocervix, the outer part, visible during a pelvic exam. Cervical cancer typically starts in the transformation zone, where these two parts meet. Causes and risk factors. The primary cause of cervical cancer is persistent infection with high-risk types of the human papillomavirus HPV. Major risk factors include 1. Human papillomavirus HPV infection. Over 90% of cervical cancer cases are linked to HPV, especially type 16 and 18. 2. Early sexual activity increases the risk of HPV infection. 3. Multiple sexual partners. More exposure increases the likelihood of acquiring HPV. 4. Weakened immune system. Conditions like HIV or use of immunosuppressive drugs. 5. Smoking doubles the risk due to toxic substances that damage cervical cells. 6. Long-term use of oral contraceptives slightly increases the risk after 5 years or more of use. 7. Lack of regular screening pap smears or HPV tests, missed early detection opportunities. 8. Socioeconomic factors, limited access to healthcare, screening, and vaccination. Types of cervical cancer. 1. Squamous cell carcinoma 70-90% arises from the flat cells lining the cervix. 2. Adenocarcinoma 10-25% begins in the glandular cells of the endocervix. 3. Adenosquamous carcinoma contains both squamous and glandular cells. 4. Rare types, small cell carcinoma, clear cell carcinoma, etc. Symptoms. Early stage cervical cancer often has no symptoms. As it progresses, common symptoms may include abnormal vaginal bleeding, especially after sex or between periods, unusual vaginal discharge, watery, pink, or foul-smelling, pelvic pain, pain during intercourse, urinary or bowel changes in advanced stages. Screening and early detection. Early detection through screening is key to prevention and successful treatment. Screening methods. 1. Pap smear Pap-Nicolau test detects precancerous or abnormal cervical cells. 2. HPV DNA test detects high-risk HPV strains. 3. Visual inspection with acetic acid via low-cost method used in resource-limited settings. Screening guidelines. WHO recommendations. Start screening at age 25 or earlier. Depending on national guidelines, screen every 3 to 5 years, depending on method used and previous results. Stages of cervical cancer. FIGO system. Stage 1. Confined to the cervix. Stage 2. Spread beyond cervix, but not to pelvic wall or lower vagina. Stage 3. Spread to pelvic wall or lower vagina. May affect kidneys. Stage 4. Spread to bladder, rectum, or distant organs. Diagnosis. Pelvic examination, colposcopy, detailed examination of the cervix, using a special magnifying device, biopsy, removal of a small sample of cervical tissue for testing, imaging tests, MRI, CT scan, or PET scan, to determine extent of disease. Treatment options. Treatment depends on the stage, type, and overall health of the patient. Early stage treatment. Surgery, for example, hysterectomy, trachelectomy, laser therapy, or cryotherapy for precancerous lesions. Advanced stage treatment. Radiation therapy. Chemotherapy, commonly cisplatin-based. Targeted therapy, immunotherapy for recurrent or metastatic cancer. Prevention. Primary prevention. HPV vaccination. Effective against HPV type 16, 18, and others, recommended for girls and boys aged 9-14 years, can prevent up to 90% of cervical cancers if given before sexual activity. Secondary prevention. Regular screening and prompt treatment of precancerous lesions. Tertiary prevention. Appropriate management of cancer cases to reduce complications and deaths. Prognosis. 5-year survival rate. Early stage. 80-90%. Advanced stage. Drops significantly. Prognosis depends on early detection, treatment access, and patient's overall health. Living with cervical cancer. Physical and emotional challenges, especially with advanced disease or fertility issues. Support services include pain management, psychological support, palliative care in terminal stages. Conclusion. Cervical cancer is highly preventable, yet remains a leading cause of death in women due to gaps in vaccination, screening, and treatment. With early diagnosis, timely intervention, and community health education, cervical cancer can be eliminated as a public health problem in the coming decades. It is always advised that you ask for help and support when you're struggling with any health condition. If you need additional information, drop a comment and expect our prompt response.